Across Vermont today as members of the Vermont Workers Center demanded Governor Phil Scott cut the state's contract with OneCare Vermont, which manages the state's all-payer model initiative. Local 44's Devin Bates joins us now live in the newsroom with more on this story. Devin?
Well, Lauren, OneCare Vermont oversees health care reform in the state and distributes money from Medicare and Medicaid to hospitals to slow their spending. The Vermont Workers Center and other nonprofits say OneCare is actually hurting Vermonters and that rising health care costs and low wages for care workers prove that.
We don't want to be seeing our healthcare dollars, money that could be spending on healthcare, Medicaid dollars, going towards this for-profit private company.
In a June report, Vermont State Auditor Doug Hoffer recommended the Green Mountain Care Board design a transparent method to monitor OneCare and determine whether or not its intended benefit to the healthcare system outweighs the company's operating costs. On Friday, Governor Phil Scott and his administration said they're looking to reboot OneCare and the all-payer model, not abandon it.
I think we owe it to everyone to keep moving forward on the all-payer model for the full 5 years, and I believe that it can be improved, it can work, but we have to prove ourselves.
Protests were held in Burlington, Barre, and St. Johnsbury on Friday, with an additional event scheduled for Saturday in Bellows Falls. OneCare went over its Medicaid budget by $17.4 million last year, leading organizers of the protests to accuse the company of using Medicaid as a slush fund. Instead, they want a universal health care system.
We know he's considering the future of OneCare, and we're bringing a very strong message saying that it's time to cut the contract with OneCare and move towards a public health care system. We think that Medicaid money should be going towards ensuring that everyone gets the health care that we need.
The Scott administration's plan to reboot OneCare and the all-payer model should be finalized by the end of this month. Agency of Human Services Secretary Mike Smith said there's reason to be optimistic.
I've seen the all-payer model work during the height of the pandemic. It was probably the single most effective instrument that we had in order to get prospective payments out to the healthcare institutions to avoid any collapse of healthcare.
It's supposed to have 526,000 people enrolled in OneCare. So far, there's just 160,000, but Governor Scott has hopes to boost those numbers in the coming months. In the newsroom tonight, Devin Bates, Local 44 News.